I am announcing 3 new voluntary public health measures in the Edmonton zone. These measures are voluntary because we still have sufficient hospital beds and capacity to meet the current needs in Edmonton. But we are moving forward with them because it is important to use our current data as a call to action. First, all family and private social gatherings should be limited to no more than 15 people. This is the maximum. The fewer people we come into contact with, the lower the risk of exposure or of us exposing others. This does not impact schools or more formal gatherings such as theatres, worship services, or other gatherings where an organizer is ensuring that all COVID guidance is in place. In these other settings, though, it is critical that all COVID guidance be followed carefully. For wedding receptions and funeral receptions, we recognize that these events in the near term have had a great deal of planning that has gone into them. It may not be possible to reduce these immediately to 15. However, if possible, we would encourage anyone planning these kinds of private social events or parties and family gatherings to reduce numbers as much as possible, aiming for no more than 15. Second, I am recommending that masks should be worn in all indoor work settings, except when alone in workspaces, such as cubicles or offices where you can be safely distanced from others or an appropriate barrier is in place. Finally, I am asking everyone in the Edmonton zone to limit their cohorts to no more than 3. Their core household cohort, their school cohort, and no more than one other social, sport, or other group. In some rare cases, individuals may belong to a work cohort as one of the 3, but this is not something that everyone would be a part of. Remember that a cohort is a group of people who don't have to follow all COVID restrictions at all times to enable an activity such as a team sport to take place. This is not the case in most workplaces. In almost all workplaces, measures should be in place to prevent close contact between co-workers, and therefore they would not be considered a cohort. Young children who attend childcare could be part of 4 cohorts, given that childcare cohorts have not been seen to be a high-risk context for spread, and young children are at lower risk of spreading the virus. These measures are not being taken lightly, but are necessary to prevent the spread of COVID-19 from continuing to escalate. Alberta Health Services will be continuing inspections of public serving businesses to ensure that existing guidance is being followed. In the coming days, the Alberta government will continue to support vulnerable Albertans and those most at risk of severe outcomes from COVID-19 to minimize the risk of exposure. While these measures are voluntary, I live and work in Edmonton, and I know that our community looks out for one another. I believe people will do their part to protect themselves and their family, friends, and neighbours. We will continue working with Alberta Health Services and local municipalities to closely analyze and monitor the spread in Edmonton and across the province. We will continue to assess the impact of these recommendations and consider any adjustments if needed. We made a commitment to Albertans when we started our relaunch that we would be transparent in the measures that would prompt reversals in our easing of restrictions, and those were clearly our acute care utilization metrics. We haven't hit that, and so again, we're keeping our promise to Albertans that those mandatory measures are linked to those 2 key metrics, and at the same time, by these measures today, we're giving Edmontonians the opportunity to bend that curve before we start to see that significant acute care impact. So it really is up to Edmontonians to pick up this challenge, which I believe we are up to that challenge, and make a difference before we start to see that acute care impact. And again, I think this is something that we can do together. So the messaging is really focused on reminding people that even if they themselves are not at high risk of severe outcomes, their actions matter to those around them. And taking actions to protect each other is, again, the only protection we have from COVID-19. So we are working with a team, as I mentioned, that has been doing some focus group interviews, trying to understand what messages are resonating with people and what motivates people to take different actions. And we haven't completed that work yet, so I don't have specifics, but what I will say again is that important message of taking these actions not just for yourself, but for the people around you, and thinking about the people that you love in your life who might be older than 70 or who have chronic medical conditions, and treating everyone around you the way you would want others to treat those that you love. So again, this is about us coming together as a community and helping each other get through this. While these voluntary measures are focused on the Edmonton zone, everyone in the province should take note. We must all take precautions to limit the virus's spread to our friends, family, and loved ones. I especially caution Albertans against planning large get-togethers this weekend. Now is not the time to be gathering in large groups, traveling long distances for the holiday, or sharing food or utensils with people outside your cohort. Keep your Thanksgiving small, keep it safe, and protect one another. I know that the need for voluntary measures and the caution against gathering with extended family and friends is disappointing to many. It has been a long, hard year, and the fight against COVID is far from over. But we have learned much about this virus, and our collective action is incredibly powerful. By working together, we can all protect each other, reduce the spread, and lift these measures as soon as possible. Now more than ever, we need to take care of each other and help protect each other.